This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Thanks, Mark. Hello and welcome everyone to our October edition of Caring for Kids. I hope everybody listening is well and enjoying this lovely fall weather. On tonight's show, we have a great lineup, as usual. We'll be discussing the health and wellness of children and families. And joining us will be Kalass, the Chief Executive Officer of Starfish Family Services, Tom Lewand, the President and Chief Executive Officer of the Marygrove Conservancy, and Shannon Wilson, the current Director of Medicaid Outreach and Quality for Priority Health, who will also have a significant role in leading the recently established Total Healthcare Foundation. It's all coming up next, right here on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everyone. Larry Burns here, October edition of Caring for Kids. Joining me now is Kalass. Ann is the Chief Executive Officer of Starfish Family Services, a role she has held since 2007. In her role, Ann has expanded Starfish's impact in Inkster, Detroit, and many surrounding communities. Starfish currently serves more than 4,000 children from birth to age 17 across Wayne County on an annual, everyday basis. In 2016, Ann was appointed by Governor Rick Snyder to the state's 21st Century Education Commission to contribute to the development of a long-term strategy to drive necessary improvements to educational outcomes for all Michigan children and to better prepare students for a global economy. She is currently on the state's Office of Great Start Advisory Council and has 25 years of management and leadership experience in the profit and nonprofit sectors, including 13 years at Ford Motor Company prior to joining Starfish. Well, Ann, welcome back to Caring for Kids. It's great to see you in person.
Thank you for having me.
Which means a lot in today's world because we don't see each other that often in person. It's more of Zoom and other stuff. So it's great seeing you in person. So let's start by asking you to give us an update on some exciting things going on at Starfish.
Sure.
I know there's many.
Yes, and thank you again, Larry, for having me, and most importantly, thanks for the partnership and the investments of the Children's Foundation in Starfish and in the families that we have the privilege to work with. So I think we're going to talk about it a little bit more, but I just want to frame anything that I say today in the context of the pandemic and these really challenging times that we're working our way through, all of us individually and as organizations. And I also would just like to frame my updates on exciting activities at Starfish in a couple of core beliefs that we have as an organization. And the first is that we deeply care, like you, about children in our community, and we bring a belief that all children in southeastern Michigan can grow and learn and thrive, whether they come from families with lots of resources or they live in families that have economic, educational, mental health challenges, that all kids, if we meet them where they're at, can grow and learn and thrive. And then the second belief that's really relevant to something we're going to talk about today, our work at Marygrove, is the fact that children grow and develop in the context of families and neighborhoods. And so in our work at Starfish, we have to think about the children, the parents and caregivers, and the communities in which those kids are growing. And so the couple of exciting things that we have on our docket, I think since the last time we spoke, is the very exciting educational work that's happening on the campus of Marygrove that puts children in the center of economic redevelopment in Northwest Detroit. And Starfish is just so excited and really feeling honored to be the early childhood provider that will be part of this cradle to career educational campus. And I think we'll talk a little bit more about that. And then the second piece of work that I think goes back to these values that I talked about is a relatively new program for Starfish called Nurse Family Partnership, and it's a home visitation program that partners nurses with first-time mothers during pregnancy to ensure that women are having great birth outcomes and that we are helping both parent and child thrive.
Well, thank you. And as you know, when we started on this journey back 3 years ago as a community-based foundation for children, you were one of our first partners, all due to the fact of the things that you explained about what your mission is and what your core values are as it relates to us, giving children of all different backgrounds an opportunity to be successful in their lives.
Right.
And that's what it's all about. And so I know, and you mentioned it briefly, that COVID-19 has impacted you. You and I had some discussions back in March about that. So if you don't mind sharing a little bit with our listeners how you've been impacted and then how I know that you've adjusted as best that you can.
Sure. So thank you for that question, because the pandemic is really the context of everything that we're doing today at Starfish. And, I really want to start with a shout out to the philanthropic community here in Michigan and Southeast Michigan, and certainly the Children's Foundation at the top of that list.
Thank you.
For really very nimbly and generously coming to the conversation and to the aid of organizations like Starfish. And I remember very gratefully a phone call that I received, I think the third week in March, from the Children's Foundation to ask what we needed. And very soon after, we had additional resources and just flexibility in our partnership to do the right thing for children at that moment. So definitely philanthropies played a huge role in supporting Starfish families. So really what the pandemic has looked like is a lot of stress and anxiety, both for Starfish families and for our employees. So we work in communities and neighborhoods in Southeast Michigan that have been disproportionately impacted by the virus, both being sick and deaths, unfortunately. So it is not unusual around Starfish for the families that we're working with or our staff to have lost a number of people. And so all of us, to varying degrees, are carrying the burden of the pandemic. What Starfish really did was overnight in mid-March, we reinvented ourselves as a remote operation and remote programs. And I think most relevant to our partnership with you, where we're both working to improve the quality and access for children to mental health programs, is we really reopened as a telehealth agency. So that meant getting technology, getting equipment, getting data plans to families, and really creatively finding new ways to connect with families that were already facing mental health challenges. And, what we see in children, and I'm sure you hear about it day in and day out in your work at the foundation, is that children have just lost so many of the connections that they had in their lives, their routines, their positive relationships with teachers at schools, with their therapists, with counselors. They're not seeing their physicians like they normally would. And so
they're not even seeing their friends like they normally would.
Right. So they're just completely disconnected and isolated. And also in the context of mental health, many children for months are quarantining with family members that sometimes are the source of some of their mental health challenges. And so our therapists, through telehealth, through phone, through video applications, have really become a lifeline to these children. We've also really ramped up, and Children's Foundation supported Starfish in this work with our basic needs. So we have supported thousands of families with diapers, because that's the start of the healthy day, is to have a dry bottom. And we have fed thousands of families, and again, getting telehealth equipment and technology, the data plans to families.
Excellent. We're talking with Ann Kalass, who's the CEO of Starfish. And I recently had the opportunity to visit the Marygrove campus. In fact, later on the show, we're going to have Tom Lewand, who is the leader of that project and your partner in that. Saw the building that's under construction that you're going to occupy, and you mentioned it briefly about the early childhood programs are going to be in there. But specifically, what excites you the most about the Marygrove initiative and that new building?
Great. Well, thank you. And I'm so happy to know that you got on the campus, because it is just a beautiful hidden gem in our city of Detroit, the campus of Marygrove. So what gets me excited about this project is that in my 13 years at Starfish, it's the first time that I've seen an economic redevelopment plan put children in the center of the plan. And so we are working on a first of its kind, sometimes called a P20, sometimes called a Cradle to Career educational campus right there on the beautiful campus of Marygrove. And Starfish is proud to be the chosen provider of the early childhood programming in a brand new exemplar center, which you saw it now has walls and a roof, and that construction has carried on over the last several months. And the Early Childhood Center will open September of 2021, so we're about 11 months out.
It's less than a year.
Yes, and what's exciting is not only the campus and the continuum of education where children are going to get a foundation of healthy growth and development in the Early Childhood Center and then move on to a new K-12 program through Detroit Public Schools Community District. So it's about reinventing the continuum of education for Detroit children, but also the Early Childhood Center is really going to become an epicenter of innovation and rebuilding the early childhood system in Detroit to look at best practice around facility design, around curriculum, about how we bring a whole child focus into that building and how we serve children.
And what will be the age group in that building that you'll be serving?
So we'll really start with our work at Starfish prenatally and have center-based program from birth to 5 until the children transition into the school at Marygrove for kindergarten.
Yeah, that's terrific. And I'm familiar with Marygrove because, believe it or not, back a long time ago, I was on the board of Marygrove.
Okay. Huh.
So my aunt, sister Margaret Burns, was a IHM. She's deceased now, and she got me involved, and I was a board member, which surprised most of my friends to be on a college board based on my academic performances. So Marygrove is a jewel that's being rebirthed in a community in Detroit that will benefit greatly, and so how exciting to be part of that.
Yeah, and it's amazing. And just building off of your connections on the board there, I think the more people I speak with, it's a center of many people's lives and history, from going to school there, from teaching there, from being married there, having their wedding reception. So it is just we as partners, whether it's Starfish or Detroit Public Schools Community District, our University of Michigan partners, the Marygrove Conservancy, really feel this deep sense of responsibility to build on the legacy of the work that's happened there for Detroit students and, issues of social justice and the power of education to carry all of those values forward into the future.
Yeah. Great. And you mentioned a little bit about our partnership and our funding of some of your programs. And can you talk briefly about what the Children's Foundation has helped you with?
Sure. The Children's Foundation has been an investor for sure in our work, but as well just a thought partner. You've helped us with advocacy. You jumped in, as we talked about, during the pandemic. But I would say that the Children's Foundation has really been core to Starfish's ability to innovate and to meet some of the often forgotten needs of the children that we work with. At Starfish, we're really proud to have a very integrated model of care that recognizes children often bring multiple challenges to us, and sometimes children can fall through the cracks of the public funding systems.
Absolutely.
And so you were a core investor in innovative center in Dearborn that we operate called the Partnering with Parents Center, that really brings a multidisciplinary approach to mothers and fathers and children birth to 6. We find that a lot of the children that we're working with have early speech delays or need occupational therapy, and there's really no public funding stream to go to for some of those children. So you've allowed us to do that work. And the Children's Foundation has also been allowing us to grow and innovate for children that have either disabilities or delays in their physical or intellectual development, and really trying to meet the needs of children that just don't fit into the public system sometimes.
Yeah, well, we're delighted to help in the way that we can, and we have every intention of being there with you for many, many years. So
well, we thank you.
You're welcome. Thank you. And I look forward to visiting in September the new building and staying in touch, obviously, before then. So, Ann Kalass, thank you for all you're doing.
And thank you, Larry, so much to you and your team.
You're welcome. And look forward to our future together. And that's Ann Kalass, Chief Executive Officer of Starfish Family Services. Next, we're going to continue the discussion about the Marygrove project with Tom Lewand, who is the CEO of the Marygrove Conservancy. That's when Caring for Kids continues right here on the great voice of the Great Lakes. News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
Welcome back, everybody. Larry Burns here for October edition of Caring for Kids. I'm delighted to see my friend Tom Lewand, who is the Chief Executive Officer of the Marygrove Conservancy.
Larry, great to be with you.
Tom, great to see you. The Conservancy represents a transformational partnership among the Kresge Foundation, the University of Michigan, the Detroit Public Schools Community District, and others like Starfish. Ann was our most recent guest. That is redeveloping a 100-year-old college campus in a wonderful Detroit neighborhood. Prior to this role, Tom was the Chief Executive Officer of Shinola Detroit, where he oversaw the partnership with Dan Gilbert's Bedrock Detroit development team to create the award-winning boutique Shinola Hotel in the heart of downtown Detroit. From 2008 to 2015, Tom was the president of the Detroit Lions, where he held many different positions and responsibilities within the front office during his 20-year tenure with the Lions, which began in 1995, including acting as the club's principal player, contract negotiator, not easy, representing the franchise on NFL matters, serving on NFL committees, and overseeing the development and construction of the fabulous Ford Field, which opened in Detroit in 2002. Tom holds 3 degrees from the University of Michigan. Very impressive. A bachelor's degree, a law degree, and an MBA from his beloved University of Michigan. Tom, welcome to Caring for Kids.
Thanks, Larry. As I said, great to be with you and great to be talking about a fantastic subject.
Absolutely. And as I mentioned offline, Ann Kalass was with us a few minutes ago, and we started talking about Marygrove, and now we're going to go in a little deeper. But I'm going to first ask you, I just reviewed your diverse background, both educationally and professionally, with arguably 2 of my favorite products, Shinola watches and the Detroit Lions, and Marygrove, as a former trustee of Marygrove back many years ago. But first, tell us about your career journey and how all of those things have, in your opinion, prepared you for this new one.
Well, I think, Larry, there's a through line in the things that I've been fortunate enough to do, and that through line is Detroit. I was fortunate to grow up here. I can recall taking the bus down Woodward Avenue to go visit my dad at his office or go see Santa at Hudson's when it was there, and got a lot of great memories of Detroit. Detroit has meant so much to me and to my family. And even, during my time at the Lions, the Ford family always viewed the Lions as a public trust. I think that doesn't change under Sheila Ford Hamp's leadership. They've always viewed the Lions as more than just a football team, as evidenced by their commitment to building the stadium in Detroit almost 20 years ago now, when a time that nobody thought they'd come back from Pontiac and people wouldn't come back from the suburbs to the city. And obviously they disproved that. And that was tremendously exciting because not only did the football team come back, but the other things that came with it, the Super Bowl, the Final Four, the Frozen Four, the college football games, so much excitement that has come down to that corner of Comerica Park and Ford Field and what it means to the city. And the same thing at Shinola. One of the things that drew me to Shinola was the commitment that they had to create good jobs, good manufacturing jobs in our city, and that's important. And so the more I was involved in things that were beneficial to the community, the more I realized I wanted to lead with that, not just make it a part of what I was doing on a daily basis. And so when the opportunity came up to join the Conservancy and join great folks like Ann and Elizabeth Moji at the University of Michigan School of Education, obviously Dr. Vitti and Alicia Merriweather at DPSCD, and then the great folks at the Kresge Foundation, and to see if I could play some small role in helping them fulfill this amazing vision they have for the Marygrove campus, it certainly met the criteria that I was looking for in the next challenge.
Yeah, wonderful. Well, that makes perfect sense. And so, as I mentioned that with Ann, we talked briefly about Starfish's role in the building that's under construction that Jill Nelson and I recently saw. And can you give the listeners, and we're talking with Tom Lewand from the Marygrove Conservancy, sort of a time frame and a 30,000-foot view of what the campus is going to evolve into?
Sure. The timeline really began about 2.5, 3 years ago as Kresge got involved in working with the IHM sisters who had started Marygrove, actually not at that location, but as you know, Larry, they started in Monroe and then moved to the Marygrove, current Marygrove campus location in the early part of the 20th century. And so they've really built a century of service in a legacy there, service to the community, service to obviously the students who came through Marygrove College. But when those two forces joined together, the college and Kresge, to begin to ideate this next vision, and then certainly with the involvement of U of M, with DPSCD, and with Starfish, bringing life to that vision of what the core of this campus can be all about. So the timeline is that vision started about 2 years ago. Amazing work that was done by the team at Kresge, and Starfish, Marygrove, and Michigan to start a ninth grade class. The ninth grade class started 2 years ago, actually finished their first year this past June, obviously virtually for the end of it like everybody else. And the 10th grade class started this year. So we'll add a class every year, add 11th grade next year, add a 12th grade, then we'll have the full high school complement. You and Ann talked about the opening of the Early Childhood Learning Center next year, so we'll have sort of both ends of the spectrum, the high school kids and the youngest kids on campus. And then as we fill that out, by the time we get to that full 12th grade, we expect that everybody else will join in, and we'll have a full complement of over 1,000 kids on campus. And at the same time, we're going to look at the rest of campus. That educational nucleus of our campus is just that. It's the nucleus. We have to build out the rest of the atom. And we hope that that takes on a lot of different forms and shapes, but with a common through line. And the common through line, it has to be great for the neighborhood. Right. It's got to be great for kids and families in those neighborhoods. And I think the work that's been done so far sets that up really well, because the curriculum at the school at Marygrove, at this fantastic P20 Cradle to Career Education Center, is focused on a couple primary things. The first is social justice. It's a foundation of social justice in every class, and every day that the kids come into the building or tune in remotely, they're talking about some of those challenges and how social justice impacts everything that we do, from economically, socially, you name it, there's a social justice impact and element to it. And then design thinking is the other principle. Being able to problem solve, being able to teach kids through different disciplines to look at ways to problem solve through their education differently than perhaps kids in other schools, not just around Detroit, but around our entire region. So this innovative curriculum developed by Michigan and DPSCD for those kids, piggybacked on by Starfish for the younger kids, really begins to set up this incredible ecosystem where you've got kids now, not just in their school days, but in other things around campus. Our incubator that our COO, Rachel Allen, spearheaded, that started earlier this year, that has a number of different organizations from around the community that are coming to campus that could also help service those kids. So it's a much more comprehensive experience than just a school day.
Yeah, absolutely. And one of the things I loved seeing on our tour recently was Madame Cadillac, the space being renovated for the 9th grade and 10th grade, taking a wonderful 100-year-old building and rebirthing it with technology is so cool. So
yeah, it's really special. I think when you see the great old bones of these 100-year-old limestone buildings being brought back to life, and I think it's even cool. And when we saw it when we walked around campus, when you take a look at the 9th grade and the 10th grade, it's not just what happens outside the building, but as you start to remove some of the darker walls, the heavier walls, and open them up with windows, you really start to see even more of the beauty of these structures and how bringing them back to life creates a value in beauty that the community needs. I think that's something that we don't pay enough attention to sometimes.
And I was very interested in you, if you don't mind talking a little bit more about it, U of M and Detroit Public School, their curriculum development of teaching children different than you and I were taught in grade school or even high school. Like, here's the book, read the book, and we'll give you a test. So tell us a little bit more about that, if you don't mind.
Sure. I think it all starts even earlier in the process. What Elizabeth Moji and the University of Michigan School of Education has envisioned for this campus with the support of DPSCD is really transformational. They're really looking at how do we not only teach the kids, but how do we teach the teachers to teach the kids? And so by creating what is really the first teacher residency program, almost like a medical school where you graduate from medical school and then you go through a residency program. Right. Well, that's what Elizabeth and Alicia and Nikolai have created at the school at Marygrove, where you have these amazing folks from Ann Arbor who are teaching at the school along with other DPS-CD teachers, and they're participating in programs both in Ann Arbor and teaching down in Detroit, participating in professional development with folks like Dean Moji, one of the leading experts in education in the country. So being able to create that infrastructure and ideate on that curriculum is really transformational, because it's not just today's curriculum with the social justice underpinning, but what does that mean for tomorrow's lesson? What does that foundational element of social justice mean when we tackle tomorrow's problems? I'll give you another example on what it means and what this combination of design thinking and social justice can mean practically. The kids in the 9th grade were actually involved in designing the new school that they'll be studying in. So as they were looking at, as the 9th graders were in there looking at what the 10th grade space was going to look like and how many of those walls we opened up, they were actually participating in that process as junior architects, working with our architectural team. Right. So you can see that you're already opening up the lens for those kids into different career opportunities, different pathways that may not have naturally come their way in a typical curriculum.
Yeah, we can learn so much from asking those questions and getting kids involved. And so one of the, you mentioned the Kresge Foundation, and we're so fortunate to have the Kresge Foundation in our community and dedicated to things like the Marygrove Conservancy. And so tell us about their involvement and then how others are helping. And, one of the reasons that Jill and I visited you is the Children's Foundation needs to be part of this in some way, shape, or form, financially, programmatically, or something. So talk a little bit about Kresge Foundation and then how others are getting involved, and then maybe how others might be able to get involved over time.
Sure. Well, first of all, the Kresge Foundation is a fantastic organization, great people that have done great work not only here in Detroit, but around the country. And I think the greatest compliment I can pay the Kresge Foundation is that I've been working at the Conservancy now for about 9 months, and I've only learned details on a fraction of what the Kresge Foundation does, literally hundreds of millions of dollars of support that they give to organizations all around the city of Detroit and Southeast Michigan, as well as I said earlier, around the country. We've just got some exciting programmatic elements that we're continue to develop with them, over and above the fact that they've made one of the largest commitments in the history of the Kresge Foundation in the form of their involvement with the P20 program. So for them to step up with their original commitment of $50 million for that program, to support us in the way they have as the Conservancy has developed, and to open the doors, as you said in your question, for others to come in and be a part of this. That's the exciting part to me, is what else. We've got this great core of this educational destination. How do we build on that core while staying true to that mission of our cradle to career education? And things like, and I know we talked about it on campus, when you can provide other services to those kids and families in the neighborhoods. So as an example, with University of Michigan, bringing the dental school in and having a dental clinic, they're what they call RAS, a division of their health system that comes in and looks at a comprehensive regional approach to helping the kids, not just at the school at Marygrove, but potentially other schools around the area, and families, of course, in the Fitzgerald and Bagley neighborhoods as well. And those services that they're going to need don't just stop with their mouth or with needing a Band-Aid on a scraped elbow. Right. Things like mental health services, social work needs to be a part of that. And there are so many opportunities to do that. And what we think we can do on the Marygrove campus by creating the kind of destination where those elements can live together in a way that hopefully allows us at the Conservancy to be the rising tide that helps lift all of those ships, so that they can in turn then serve the community even better than they could individually.
Yeah. And lastly, if you don't mind mentioning, you mentioned the incubator. I had a great opportunity to see that. It's very cool. A couple of the organizations that I know our listeners are going to be aware of that are there already, if you don't mind.
Yeah, we've got 5 great organizations. The one that folks will most immediately identify with is the Detroit Youth Choir. Right. Obviously, the great success they had on America's Got Talent and the great work they continue to do.
And if I may, they just, my friend Alexander Zonchek just released a new album. And the choir is on a song, and it just sounds, it's In the Deep, the song, which is a great song by Adele, and they just sound fabulous. So
they're fantastic. And, they've, in our incubator, we have all of 5 organizations in one spot on campus, so they can share ideas, they can share services. We have a executive in residence that can help them with their business plans, help them develop their fundraising plans, the other things that they have to do to be successful. We have programmatic things for them so they can share ideas, resources, financial assistance, helping with, as I said, the business plans, but also their financial plans, helping them with their tech needs, and then being able to avail themselves of the many resources that we have on campus. As an example, the Detroit Youth Choir will use some of the old music space and rehearse in there, some of the great theaters that we have. But we've got some other great organizations, the Detroit Phoenix Center that helps kids who are challenged either with food insecurity or housing insecurity and providing service for them. And not that this has any connection to my past, but the Detroit City Lions, a great organization that takes care of literally hundreds of kids. They not only allow them to participate in sport, but they provide a lot of additional services to help the kids with their homework, to get some supplemental tutoring, and to get deal with food insecurity as well. So you're creating an environment for the kids after school that is as healthy or healthier than what they get in school. And other great organizations as well, a group called Journey, whose mission is really to teach kids in the neighborhoods about opportunities for professional development in technology, helping them with coding, helping them understand a lot of the ways that you can find a career in tech. And those kinds of opportunities are not as plentiful in neighborhoods around Marygrove as they are in the suburbs.
Yeah, absolutely.
That's not right.
So wonderful. Tom Lewand, thank you so much for what you're doing. And I happen to think this latest journey that you're on at the end of the day may be the most rewarding. It just might be. So
I think you might be right.
And, staying true to Detroit. And so thank you for all you're doing. Thanks for being on Caring for Kids. And if you don't mind, we'll stay in touch. And
love to. And thank you for the work you're doing. And we look forward to having the Children's Foundation on campus.
Absolutely. And so that was Tom Lewand, Executive Director of the Marygrove Conservancy. Coming up next, we're going to hear from Shannon Wilson of Priority Health when Caring for Kids continues right here on the great voice of the Great Lakes. News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Joining me now is Shannon Wilson. Shannon is the Director of Medicaid Outreach and Quality at Priority Health. In her role, Shannon works to promote high-quality care for members through the development of innovative community partnerships and other quality improvement strategies. Prior to accepting her role at Priority Health, Ms. Wilson served as the Executive Director of the Grand Rapids African American Health Institute, Vice President of the Alliance for Health Scientific Program Coordinator at the Centers for Disease and Control and Prevention, and the First Health Disparities Epidemiologist at the Michigan Department of Health and Human Services. Shannon received a bachelor's in science in microbiology from Michigan State University, go Spartans, and a master's of public health and hospital and molecular epidemiology from the University of Michigan, go Wolverines. She is currently pursuing a doctorate in public health leadership from the University of Illinois, Chicago. Go Illini. How am I doing? In addition to her current role, Shannon is also an adjunct assistant professor in the Michigan State University College of Human Medicine. And I welcome Shannon to Caring for Kids. Tell our listeners about your background. I talked about that in our intro, and then a little bit about your current and evolving role at Priority Health.
First and foremost, thank you so much for having me on today. I'm so glad to be here talking more about the wonderful work that we're doing between Priority Health and our new collaboration with Total Healthcare, and also with you all at Caring for Kids. So my name is Shannon. Yep. I am born and raised on the west side of the state, did undergrad at Michigan State University, grad work at University of Michigan. I would say go green, but others may have something else.
Right. I mentioned that in your intro.
I have worked for the last 14 and 15 years, really at the intersection between race and health and caring for some of our most vulnerable populations. Really passionate about that work. And I've been at Priority Health for just under 2 years and am able every day to really live out my passion. And so working with the Medicaid population, we work with some of our most vulnerable members here in the state of Michigan, all across the state of Michigan, making sure that they have access to high quality healthcare and that each and every day they are able to live out their life's best. And we know that health can be an impediment to that sometimes, and we want to make sure that that does not happen. And so really excited about the work that we're doing at Priority Health and my role in particular as the Director of outreach and quality. I make sure that, again, our members have the highest quality outcomes in the state. We are one of the highest rated plans in the state. And then I make sure that when they show up in community, that our relationships with community organizations will support their life's journey.
Yeah, wonderful. And your population is our number one priority, too, for the Children's Foundation. And we have over 100 partners now, and many, if not most, many of our partners have the same population, be it a Medicaid population, certainly an underserved population. And we're really trying to provide not only direct health care, but social determinants of health that allow children and families every day to have a real chance to have healthy lives. So there's a lot of things we're doing together that excites me. And so now Priority Health, and you mentioned Total Health Care, now have a presence in the Detroit area. And so what are some of the goals and objectives of the new foundation that was created as it relates to moving forward with that foundation? Can you talk a little bit about that?
I can. First of all, I want to just share with you and your listeners how extremely excited we are to welcome Total Health Care and their team and their members to the Priority Health family. We are just really elated about this partnership. When we first began our conversations with Total Health nearly a year ago, we discovered that there were just so many synergies between the two organizations. And so it really made a lot of sense for us to come together, whether it be our aligned business values or our shared commitment, not only to improving the health of our state, but really focusing in on the Detroit area, Metro Detroit, and making sure that those families and those communities have the best access to healthcare as possible. We just knew that this partnership made sense. We believe that this is a partnership between two of the longest standing Medicaid health plans in the state of Michigan. And so we know that there's a lot of best practice sharing that we'll be able to do through this partnership that's really going to allow us to better serve the members of our great state. And so with this combined relationship came the formation of the Total Healthcare Foundation. And just this investment that we are making in the Detroit area seemed to make a lot of sense. And it was a great way for us to really make sure that we are impacting and helping to address some of the most critical needs that our members in Detroit have and that are affecting the residents in this great city. And so we're elated about this partnership. We're really excited to be coming into Detroit with the foundation. The foundation is really going to focus on some of those shared values that we've even talked about today, addressing those social determinants of health. And so looking at things like housing and how housing impacts someone's ability to live a healthy and productive life. Really looking at food insecurity and how food insecurity impacts that ability. Some of these things that people tend to take for granted, but that we know because we're in the trenches doing the work, that these are things that can significantly deter a person from achieving their best life. And so we want to come in and make sure that we have an avenue for addressing those and that we are investing in those realities.
Excellent. Very well said. And we're talking with Shannon Wilson of Priority Health and the Total Health Care Foundation and the Children's Foundation, which just coincidentally is in the same building as Total Health and the Fisher Building in Detroit. And the new
It was meant to be.
It was meant to be. And we've been having discussions over the last many months during COVID and before. And we're excited about our partnership assisting the Total Health Care Foundation in analyzing grant possibilities and then following them. And so can you give our listeners a little bit of an idea about the grant process and the timing of that, just so that they're aware?
Of course. And I want to thank you all for your partnership. The partnership that we have together will allow us to do our work much more efficiently. And so because of our partnership, we know that we don't have to invest in building up the operational side of a foundation, and we're really able to invest in carrying out the mission of the work that we're trying to do. And so thank you for coming to the table and being willing to partner.
It's what we want to do. So thank you for the opportunity. So on the grant process, can you give our listeners a little bit of an idea? Will it be like once a year or during the quarter, how that might work, knowing it might change over time?
We are making grant awards on a quarterly basis. To begin with, we wanted to focus in on organizations that had a proven track record, organizations that we've worked with in the past that we know are doing this great work, community. And so we've really been doing the solicitation ourselves in the beginning, but we do plan to stand up a process moving forward. Again, we are actually granting awardees on a quarterly basis. And so we're definitely always looking for exciting opportunities. You can feel free to reach out to Total Healthcare if you have any questions, but we're looking to do it on a rolling basis quarterly. We're making those announcements and hope to have some exciting news for you very, very soon.
Great. And I know that over time we're going to grant funds to the same organization. And what I like to say, 1 + 1 in that case equals 3. And so even more reason, in my opinion, to be excited about our partnership. And so in closing, is there anything else you want to share about Priority Health in Grand Rapids and Detroit that you just want our listeners to know that maybe they're not aware of?
Well, I think there are many, many initiatives that we're working on, both at Priority Health and at Total Health, that will just benefit richly those who live in the Detroit area. One of the things that we're really excited about is an announcement we made last week where we are actually investing in physician or provider capture of SDOH data and information, which will only help us fuel what is needed to really make impactful changes with the work that we're doing with the foundation. And so the ability to get that information and all of that data from our provider partners, we are the first health plan in the state that is actually providing a financial incentive for that information, but it will provide a lot of the background information we need to know where to best make our investments and how to best use our dollars. So we are really excited about this. I know you share in our excitement
I do.
about this work, and really look forward to coming on the show in the next couple of years to show the impact that we're making in the city of Detroit.
Yeah, we're going to do that together. That's a promise. And so I also want our listeners to know that if they don't, that we also, the Children's Foundation, have a presence now in Grand Rapids, where we're granting money to several organizations, including DeVos Children's Hospital, Easter Seals, Boys and Girls Club. We have a nice relationship with the Grand Rapids Drive through Steve Jabara, one of our emerging leaders of the foundation. And so I will not only be able to see you in Detroit, but you'll be able to see me in Grand Rapids. So I look forward to that in the future.
Sounds great. I look forward to it.
Thanks, Shannon. That was Shannon Wilson of Priority Health and the Total Healthcare Foundation. And coming up next, I'm going to provide some updates on the Children's Foundation, some great exciting stuff going on right here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everyone. Larry Burns here, just finishing up on our October edition of Caring for Kids. It was a great show, great lineup. We continue to have wonderful guests doing wonderful things in our community. And the Children's Foundation continues to do wonderful things as well. The Children's Foundation Board of Trustees recently approved a new and first ever strategic plan for the foundation. As a leading foundation for children and families, this will continue to guide us as we make an impact each and every day in Michigan and beyond. The foundation is currently reviewing grant applications for our 2021 Round 1 grant cycle. Be sure to tune in next month for an update on our new grants. And many, many thanks to all of you who supported the recent Jamie Daniels Foundation second annual roast, this time of Scotty Bowman. Your support is so very important to their mission, to our mission, to stop the stigma of substance abuse disorder. So thank you all very much. A great job by Ken Daniels, Lisa Daniels Goldman, and the Children's Foundation staff. Many, many thanks. So thanks for joining us tonight here on Caring for Kids, and most of all for your continued support. Be safe, stay healthy, onward.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.